is WNBC for New York. And now, this is News for New York.
Good evening, I'm Sue Simmons.
And I'm Chuck Scarborough. A revolution is taking place in hospitals across America. A new way of looking at plastic surgery. Drastic techniques once used for major reconstruction are now being used routinely for cosmetic and other reasons. And Dr. Max Gomez is here with more of this for us. Max?
That's right, Chuck. You know, it used to be that reconstructive surgical techniques were used for people with major deformities or after really serious trauma. But today these methods have become safe and reliable enough that people with problems with their speech, their chewing, pain in their faces, and so on can be helped by realigning the bones in their face. Take a look at these pictures. What looks like a plain cosmetic problem to you and me can also be very uncomfortable.
I had a gap between my upper front teeth big enough to put a pencil through. When you have a bad overbite, when you chew food, you always chew against the upper roof of your mouth. And you can raw it out, so it's just discomfort.
Glenn's orthodontist told him there was only so much he could do for his teeth, and that a real fix would take surgery. The icing on the cake was that it would also improve his profile. And so Glenn came to Dr. Darrick Antell, who used reconstructive surgical techniques on Glenn's face. All of the incisions are made inside the mouth so that nothing shows on the outside. He'll actually cut apart the bones of Glenn's face and jaw, realign them, and then bolt them back in place with new mini bone plates and screws that minimize the amount of jaw wiring required. The end result is both functional and cosmetic improvement.
When you move their jaw forward, they can breathe better. It may improve snoring at night. It improves their overall feeling because they're getting more oxygen in their body. That's one of the real advantages. The teeth fit better so they can speak better.
The results are sometimes subtle, but just as often they can make a dramatic difference in the patient's appearance, all of which can make a big difference to the patient and those around him.
Well, one thing I do notice, you do get a lot more smiles from people when they look at you.
Now, this kind of surgery is usually done in concert with an orthodontist who works to get the teeth in the best possible position before the actual surgery. And since much of the surgery helps to correct physical problems, it's often covered by insurance. Chuck, Sue?
Okay, thank you, Max.